In healthcare facilities, specific rules govern the number of receptacles that can be connected to a single circuit. The 180 volt-ampere rule, which applies in many other contexts, does not apply to healthcare facilities. Instead, a different set of regulations must be followed to ensure patient safety and reliable power distribution. In healthcare environments, a single 20-amp circuit is permitted to supply no more than 20 receptacles. This limitation is more stringent than the general rules for non-healthcare settings, reflecting the critical need for uninterrupted power to medical equipment and life support systems. Therefore, installing 13 receptacles on a 20-amp circuit in a healthcare facility is not permissible. The rationale behind this stricter rule is to minimize the risk of overloading the circuit and causing a power outage, which could have serious consequences for patients. Medical equipment often requires a consistent and reliable power supply, and exceeding the allowable number of receptacles increases the likelihood of tripping the circuit breaker due to excessive current draw. Healthcare facilities typically have backup power systems, such as generators, to provide power during grid outages. However, these systems are designed to handle essential loads, and overloading circuits can compromise their effectiveness. Compliance with the National Electrical Code, or NEC, is crucial in healthcare facilities to ensure electrical safety. The NEC provides detailed guidelines for electrical installations, including the number of receptacles allowed on a circuit, the type of wiring required, and grounding requirements. Electrical inspectors regularly inspect healthcare facilities to verify compliance with the NEC and other applicable standards. These inspections help identify potential hazards and ensure that the electrical system is safe and reliable. When designing electrical circuits for healthcare facilities, it is essential to consider the specific needs of the different areas within the facility. For example, patient care areas may require more receptacles per circuit than administrative areas due to the higher concentration of medical equipment. Additionally, critical care areas may have even stricter requirements to ensure the highest level of power reliability. The selection of receptacles is also important in healthcare facilities. Hospital-grade receptacles are designed to withstand frequent use and provide a more secure connection than standard receptacles. These receptacles are typically used in patient care areas and other critical locations. Ground fault circuit interrupters, or GFCIs, are also required in certain areas of healthcare facilities, such as bathrooms and wet locations, to protect against electrical shock hazards. GFCIs detect ground faults and quickly interrupt the circuit to prevent injury. Regular maintenance and testing of electrical systems are essential in healthcare facilities to ensure continued safety and reliability. This includes periodic inspection of receptacles, wiring, and circuit breakers, as well as testing of GFCIs and other safety devices. Any identified problems should be promptly addressed to prevent potential hazards. In summary, the 180 volt-ampere rule does not apply in healthcare facilities. Instead, a single 20-amp circuit can supply no more than 20 receptacles. Adherence to this rule, along with other NEC requirements, is crucial to ensure electrical safety and reliable power distribution in these critical environments. Firstly, it is important to understand the purpose of the 180 volt-ampere rule. Secondly, the rule is generally applied in commercial settings to calculate the load for general-purpose receptacles. Thirdly, the NEC provides specific guidelines for determining the load for different types of receptacles and equipment. One must always refer to the latest edition of the NEC for the most up-to-date requirements. When working in healthcare facilities, it is important to have a thorough understanding of the unique electrical requirements. This includes knowledge of the receptacle limitations, grounding requirements, and emergency power systems. Proper training and certification are essential for electricians working in healthcare environments. They should be familiar with the NEC and other applicable standards, as well as the specific procedures for working in these sensitive areas. Furthermore, continuous education is crucial to stay abreast of changes in the electrical code and best practices for healthcare electrical systems. In addition to receptacle limitations, there are other important considerations for electrical design in healthcare facilities. These include the type of wiring required, the grounding system, and the emergency power system. The NEC specifies the type of wiring that must be used in healthcare facilities, depending on the location and the type of occupancy. For example, certain areas may require the use of metal conduit to protect the wiring from physical damage. The grounding system is also critical in healthcare facilities to prevent electrical shock hazards. The NEC provides detailed guidelines for grounding electrical equipment and systems, including the use of grounding electrodes and bonding conductors. Emergency power systems are essential in healthcare facilities to provide power during grid outages. These systems typically consist of generators, automatic transfer switches, and uninterruptible power supplies, or UPSs. The emergency power system must be designed to provide power to essential loads such as life support equipment, lighting, and communication systems. Regular testing and maintenance of the emergency power system are crucial to ensure its reliability. The NEC also addresses the issue of transient voltage surge suppressors, or TVSSs, in healthcare facilities. TVSSs are designed to protect sensitive electronic equipment from voltage surges caused by lightning strikes or other events. The NEC specifies the locations where TVSSs are required and the performance characteristics that they must meet. Furthermore, healthcare facilities often have specialized electrical systems for specific medical equipment, such as X-ray machines and MRI scanners. These systems must be designed and installed in accordance with the manufacturer's recommendations and applicable codes. The electrical design for healthcare facilities should also consider the potential for future expansion and changes in technology. The electrical system should be designed to accommodate the addition of new equipment and the upgrading of existing systems. This may require the installation of additional conduit, wiring, and circuit breakers. When planning electrical work in a healthcare facility, it is important to coordinate with the facility's engineering department and infection control staff. This will help ensure that the work is performed safely and without disrupting patient care. Infection control procedures must be followed to prevent the spread of infections during electrical work. This may include the use of personal protective equipment, such as gloves and masks, and the disinfection of tools and equipment. In summary, the electrical design and installation in healthcare facilities are subject to stringent regulations to ensure patient safety and reliable power distribution. The 180 volt-ampere rule does not apply in these facilities, and the number of receptacles on a 20-amp circuit is limited to 20. Adherence to the NEC and other applicable standards is crucial for all electrical work in healthcare environments. It's crucial to emphasize the differences between healthcare and non-healthcare settings regarding electrical codes. The rationale behind the stricter rules in healthcare is the potential for life-threatening consequences if electrical systems fail. Medical devices, monitoring equipment, and life support systems rely on consistent and reliable power. Any disruption, even a brief one, can have severe repercussions for patients. Therefore, the NEC has specific articles dedicated to healthcare facilities, outlining requirements that exceed those for standard commercial or residential buildings. These requirements address various aspects, including wiring methods, grounding, essential electrical systems, and isolated power systems. Isolated power systems are particularly noteworthy. They are used in critical care areas to minimize the risk of electric shock to patients. These systems employ isolation transformers that electrically isolate the power distribution network from ground, reducing the potential for current to flow through a patient if they come into contact with a live conductor. The NEC provides detailed specifications for the installation and testing of isolated power systems, including requirements for line isolation monitors that continuously monitor the integrity of the isolation. Furthermore, the NEC addresses the issue of redundant power sources in healthcare facilities. Essential electrical systems, as mentioned earlier, typically consist of multiple sources of power, such as normal power, emergency generators, and uninterruptible power supplies. The NEC mandates the use of automatic transfer switches that automatically switch to the alternate power source in the event of a normal power failure. These transfer switches must be designed and installed to ensure a seamless transition between power sources, minimizing any disruption to critical loads. Regular testing and maintenance of these transfer switches are essential to verify their proper operation. The NEC also includes requirements for the physical separation of essential electrical system components. This is to prevent a single event, such as a fire or flood, from disabling both the normal and emergency power systems. For example, emergency generators and transfer switches may be located in separate, fire-rated rooms to provide physical protection. In addition to the NEC, healthcare facilities may also be subject to other regulatory requirements related to electrical safety. These may include standards from organizations such as the Joint Commission, which accredits healthcare organizations, and state and local building codes. Compliance with these regulations is essential for maintaining a safe and reliable electrical system in healthcare facilities. Finally, it's important to remember that electrical codes are constantly evolving to address new technologies and safety concerns. It's crucial for electricians and electrical engineers working in healthcare facilities to stay up to date on the latest code changes and best practices. This can be achieved through continuing education courses, professional certifications, and active participation in industry organizations. In conclusion, understanding and adhering to the specific electrical codes and regulations for healthcare facilities is paramount to ensuring patient safety and the reliable operation of critical medical equipment. The limitation of 20 receptacles on a 20-amp circuit is just one example of the stricter requirements that apply in these environments. By prioritizing safety and compliance, healthcare facilities can minimize the risk of electrical hazards and provide a safe and effective environment for patient care.